Welcome to Mye Journey, a series of podcasts focusing on a multiple myeloma specialist and her patient's journey from diagnosis to what the future may hold. This episode of Mye Journey is presented by Duke Cancer Institute and is funded by donations to the Multiple Myeloma Research Fund. Neither Dr. Gasparetto nor Thomas Goode have been compensated for their participation in this program.
I currently serve as a consultant and speaker to a number of pharmaceutical companies and treatment organizations. And for the most up-to-date list of my disclosures, please go to my page at dukehealth.org.
My name is Thomas Goode, and disclosures include working with GlaxoSmithKline.
This Mye Journey podcast series will share the voices of Cristina Gasparetto, a highly experienced hematologic oncologist, and Thomas Goode, her patient of 16 years, in a candid conversation about how they began their physician-patient journey after Thomas' multiple myeloma diagnosis. Their journey includes building a strong relationship to support struggles, successes, and path to the future. This video podcast is the first in a series of 4 featuring Dr. Gasparetto and Thomas sharing how their physician-patient journey began with finding the right doctor, getting to know each other, and planning next steps. I'm Julie, and I'm going to be guiding discussions throughout the series of video podcasts. So, Dr. Gasparetto, are you ready to get started with Thomas to introduce yourself a little bit and get the conversation going?
Yes.
Thank you, Julie. Well, my name is Cristina Gasparetto, and I lead the multiple myeloma program at Duke. And just a little bit about myself, I guess. I knew that I wanted to focus on this disease since the beginning of my fellowship. And I don't know why. Actually, I do. One of my first patients, as a fellow, I was called to see a patient with multiple myeloma, and I went to the library. Back then, we didn't have Google, we didn't have all the gadgets, so I went to the library and read, kind of refresh my memory about myeloma and disease of the elderly, mainly men, incurable, with the overall survival of about 3 years back then. And when I went to the room of these patients, I was so surprised because she was a 42 years old, beautiful woman. She spent a fair amount of time in Italy, so we were conversing, talking in Italian. I became very attached to her. She had 2 young kids. And I started to read everything about myeloma because it was inconceivable to me that her projected overall survival was 3 years. I couldn't believe it. So I just wanted to guide her in the best way to the beginning of her journey. And I became crazy about understanding the disease. And every opportunity, as fellows, we were presenting every so often our ground round tumor board, and I was always talking about myeloma, and just learning the disease in depth. And then I went through residency, of course, fellowship at Duke, and I joined the faculty in '99, and with the mentorship of my director, Nelson Chow, I knew that I wanted to focus on the disease and development of the program at Duke. And kind of grew over the last 20 years. I think I'm, of course, a different person that I was back then. And I think I met Thomas, actually, I know for sure, toward the beginning of my career, in the beginning of his journey with myeloma, right? 16 years ago. So.
Right. My name is Thomas Goode, and a little bit about myself. I was a career person. I worked at the federal prison, and that was my onset. That was my career path that I had chose to take. And unfortunately, I got sick with myeloma, and I ended up having to go to a orthopedic specialist to get looked at, and I noticed that he did the appropriate test that I needed, X-ray and MRI, and he found the plasmacytoma, a tumor in my scapula, and he introduced me to an oncologist, and the oncologist introduced me to the radiation specialist because, like Dr. Gasparetto said, back then there wasn't a lot of treatment, for this type of disease, and I ended up doing radiation for that. So I also went to after that, he introduced me, the oncologist, he introduced me to Dr. Gasparetto because she was close. And he realized that I needed a stem cell transplant. And he said he'd know the best person for it.
But if I recall correctly, it's always struck me, first of all, how old were you when you were diagnosed?
At diagnosis, I was only 34 years old.
34 years old, which is kind of crazy, as I say, because the average age for patients with myeloma is in the mid 60s. It actually used to be in the 70s, but what's happening, we don't know. A trend toward a younger population, so we see young men, young women. I think my youngest was 20, 24, 26. And so you were very young,
Yes.
34. And again, back then, because it's been like 16 years ago, we really didn't have a lot for the treatment of this disease. And so your projected survival was not very long.
Right.
And so it's good that you were referred to a big center so we could have explored treatments, a little bit more aggressive, part of the clinical trials, and then, allowed us to establish a deeper relationship.
And that's one of the reasons why he sent me over there, is because I was so young and because I was in great physical shape. He was like, I just want to send you over here to them at Duke, and we'll go from there. So then once I met Dr. Gasparetto and her treatment staff, I couldn't leave them.
And another thing I remember that you told me from the very beginning, when they diagnose you with the plasmacytoma, which is a mass, a myeloma mass, and the myeloma is a systemic disease, it's a blood disorder, but occasionally we found what we call the plasmacytoma. They are a tumor in your scapula, and when they told you actually had cancer at age 34, your reaction, right?
Yeah.
It was kind of unexpected. It's not the thing that you were strong, in great shape.
Yeah, it's you go to a orthopedic specialist and he tells you that you have cancer. It really hits you different than you
Right.
going to a doctor or an oncologist and tell you that you have cancer. So I was in a state of shock. It's like, okay, where did this come from? It's like I just came here because I was having pain in my scapula and now it's cancer. So that was something that I did not expect, and it was just something that I had to grow with it. It had to grow on me.
Thank you both for your introductions. And I think really what we'd love to hear about from here is, how did you get started? How was the first visit? What are some stories that, when you really knew that it was the right physician, patient, team, payer there?
Well, it's hard to remember my first visit.
Yeah.
What I do remember about it is that everyone back then has a cassette tape.
Mm-hmm.
And when she walks in, she press record, and they record your entire medical conversation. So you can go back and listen to it. And she's the last one that comes in, because you have the social worker, you have the practitioner, you have the insurance people. All of them comes in first, and then she's the last one that comes in. So you're there for a long time on your initial treatment day or initial workup day. So by the time that I got to her, I was already tired. Seeing so many people, and like like before, you hear, but you don't hear. So that was one of the good things about having that cassette tape, because I can go back and listen to it and pay attention to everything that she had said that I didn't pay attention to when I was in face to face with her.
It's interesting. I forgot that we used to do that. Yeah, we had the tape for the patients, and we used to record the conversation. And sometimes, still now, we have patients coming with their own recorder, and it makes sense because you're overwhelmed.
You're
Your
overwhelmed.
first visit, you are overwhelmed, you meet a lot of people, and then we go through, we trying to explain to you what we're going to do and why and the rationale, and then you have to trust me, trust the relationship and my recommendations and why we're doing that. So I forgot about that.
And I tell people, I said, the doctor will not be mad if you ask them to
Yeah.
record. They will not be mad. They will be happy that you did it, because they know you're going to go back and listen to it.
Plus with my accent, right?
Plus with your accident.
I've been here in this country for so many years, but I can't lose this Italian accent. And sometimes, particularly now with the mask, some patients are like, "What are you talking about?" But I don't remember the details of our first visit, but from the very beginning of my journey with this disease, I really wanted to focus particularly on the young patients because I felt like it was becoming my battle, not just yours. And I wanted, to succeed. I wanted to impact on your life. There was no way, and I still do that when I see young patients. I'm still like, no, it's going to be okay. And it's difficult because the disease is so unpredictable, the complexity, and what we're going to do. But I remember you very young, and it didn't look like you had anything. And so we needed to establish a relationship.
Mm-hmm.
And at the beginning it's difficult because you come to the room and you have to listen and then again ask questions and trust. But it's very important from the very beginning that you establish that relationship with your doctor. What do you think?
It is, because back then, I hadn't heard of multiple myeloma. And a lot of people that I had talked to had never heard about multiple myeloma. So once we in the clinic, you're scared.
Yeah.
You're scared. You have all of these questions, and you're trying to find out what's the answer. And when I finally met her, my anxiety level came down. I felt like I was at a sense of at ease, because she was very comfortable with talking to me about my diagnosis, and she was very prominent about the future for me with myeloma. So I was very happy about that.
Good, I'm glad. That is what I try to deliver, when I meet a new patient, the fact that we're there, we got your back, and then you have, I'm going to walk with you throughout and making different recommendations. And you and I have done a lot of presentations. We gave some,
Talks at the
talks at school, medical students, and we always talk about, the importance of the relationship that we have established that allowed us to connect, and I think that's is becoming very, very important because as a physician, sometimes it's easy to think that you know everything about the disease and the patient has to follow your recommendation. In reality, it's not like that. You have to listen,
to
the patient, and you learn how to listen, and that is one of the most critical. The value of the relationship. We listen to each other, and I listen to you like you listen to me, right?
Right.
I think it's really great. We learned so much about how you guys started a relationship just from your first visit. And I think we're going to have a lot of opportunity to talk about all the great advocacy and patient support that you've kind of thrown your life into, Thomas and Christina. I know that y'all do a lot of that together.
We do.
Too.
Yeah, we do.
So I think it's really clear how quickly your bond formed, and that is amazing. And kind of as we bring this first episode to an end, do you have any additional thoughts you want to share? Because the next episode, we're going to jump right in to find out how your relationship has grown to be the force that it is and the bond that it is over the last 16 years.
Yes. What I would suggest for newly diagnosed patients is, again, record your conversation that you have with the doctor. Because you're going to be in a position where you're not going to hear everything that she tells you or he tells you, but you have the opportunity to go back and listen to it, and then you come back and you ask all of the questions you want just from that.
Yeah.
And secondly, I would say, be open-minded. Go in there with a heartfelt emotion to listen and hear what has to be said instead of knowing everything that goes on in the disease. Because you'll get to a point where you will get misinformation, and it will take you in the wrong direction.
No, I totally agree. And also, I think it's important for patients to understand that you have your local oncologist, you have your physician, but then seek, the second opinion, go to see someone who devoted his life, his career to understanding your disease. And it's a team effort. It's not that the local oncology doesn't play a very important part, absolutely, because it's going to deliver the care, the treatment. But your expert, in this case, your myeloma expert, is going to guide you in the best way, because we just learn the disease like nobody business, right?
That's right.
In depth, and we know what's going to happen, the future. We understand the position of the new drugs, and over the last 2 decades we had an explosion of drugs, the complexity of the disease. So very important that you seek a second opinion with an expert, and you don't have to travel all the way, but just have the myeloma expert oversee your care. And you need to do that for every disease. It's not just the myeloma.
Yeah.
We're becoming so specialized. I always tell my patient, don't ask me any question about anything else. Not that we don't know how to treat patients, of course, but we don't have any problem to focus on the disease. Yeah.
Well, thank you both very much, and it's exciting to hear about your relationship, how it started, and how it's moving on. And so we're going to bring this episode to a close and start back with just how that relationship grew so strong.
Okay.
Thank you.
Thank you, Julie.